Well, good morning, everybody. For those that have since joined, my name's Tom Calma. I'm with Poche, Sydney, and I'm your host over the next couple of days. Our apologies for the little bit of a late start. We've got people who are making contact to say that they can't connect, so we're trying to manage all of that, as well as to get all the other logistics organised for today. But can I start the proceedings by welcoming you all, and also to hand over to Rambaldini, the Director of Poche Sydney, to give an acknowledgement of country and to say a few words about today's session. Bo, over to you.
Thanks, Tom. Rambaldini is my name. I'm a proud Aboriginal elder from the Bundjalung Nation on the far north coast of New South Wales. I'd like to acknowledge that we are on the traditional and sacred lands of the Gadigal people of the Eora Nation, the lands on which I live and walk, and the land on which we come from you today to deliver this research showcase. I pay my respects to elders, our elders and our ancestors and the Gadigal people and all those who attended the showcase today. I ask that our ancestors to guide us all to a successful showcase that will deliver a positive outcome and let the world see the awesome contribution of work we do. This showcase will also lift the boundaries that divide us, and it will also be inclusive of all cultures in equity and unity. So I just want to say thank you all for attending. In the research showcase, you'll see some valuable work that's been done from people that's in the Poche Centre circle. So thank you very much. And before I go any further, look, just recently we lost a very valuable staff member, Abby Clarkson. And Abby is one of those very beautiful people that just knuckles down and does all the work in the back room and makes all the things that the wheels that turn, that make all the things that happen in this place run smoothly. Abby has been involved in our maternal demonstration project. She did all the reporting and secretariat for that particular program, and it's a program that we're very proud of because it allows Aboriginal people and Aboriginal women to feel culturally safe when giving birth to their children. And Abby's been a very important part of that project. And she's also been involved, you know that our Aboriginal people, particularly in regional and remote areas of New South Wales, we have the worst health outcomes than any other group in this country. You're probably aware that we are the only race that's entered into the National Cabinet chaired by the Prime Minister and has the heads of governments and all the state and territory governments around the country. And the outreach fly-in and fly-out clinics that we run in regional and remote areas of New South Wales is very important. And Abby also coordinated that and made sure that the students and the specialists that flew out to these regional and remote areas were on the plane to provide this clinical service to our people to try and close that gap and do whatever they can in providing treatment to make our people well. Coordination of the portable echo machines, which is very important because we all know that cardiovascular disease is a very serious issue in our community. And she's been involved in ensuring that echo machine is moved around from various Aboriginal medical services so that they could use it to identify the concerns that Aboriginal people have in regards to their heart health. And she's been very instrumental in doing that and done a marvellous job. And we know that she's going to be very hard to replace in that particular area. Our mobile clinics, she managed our mobile clinics. We've got a number of health vans that travel around New South Wales, not only in the remote areas, but also in some regional areas that they're out there to promote and prevent the issues that impact on Aboriginal people, and also show them that they need to take the responsibility for their own health needs. She has a very strong and positive relationship with the Aboriginal Medical Services and the staff that coordinate it from their end. And that's another very important project that Abby has been involved in. The administration, and we all know that unless the paperwork's all finalised, nothing's actually done. And Abby was very instrumental in the administration of our precision medicine project. And it's a project that tries to identify the diseases and how we can identify and treat them into the future. And she has been very, very important in this work as well. The data collection for our water project. There are some areas in New South Wales where we've instilled water into those areas where Aboriginal people have been, and the wider community, in fact, have been drinking water that pretty much the same colour as my skin, and it was a rusty colour. In some of those areas, this time of the year, it's extremely hot. So our kids have been, and other members of the community have been drinking water that's been hot and rusty. So obviously they were leaning towards those sugary drinks, and mainly because the water within those shops out there are more expensive than they are with the sugary drinks. So she has been very important in that project as well. Recording the overall statistics, collection of all the Poche Centre activities. It's very important because we all know that unless we let people know exactly what we're doing, people think that we don't deliver what we've actually been providing to Aboriginal communities throughout New South Wales. And because of the work that Abby does and the rest of the Poche Centre team, we've been really punching above our weight and delivering some marvellous outcomes, particularly in research and clinical work with promotion and preventive also chucked in there. So Abby's been involved in ensuring that the collection of data, because that's what governments and even the university, they look at that statistics and they see that we're coping well and operating well, and they can see that as a form of a bench of how we're operating. The network events such as this one we're on right now, the research showcase, she's been instrumental and very valuable in ensure that these projects are run smoothly, are delivered, and all the coordination and behind the scenes work that brings something like this together. People just don't understand, and having Abby, as well as doing all those other important matters that I just spoke about, then putting all the events together to ensure that a special event where we've got people coming from all over the country and even some people from outside of the country to ensure that we have a very important and well-run research showcase. She's also involved in our annual meetings, when we come together, and also our key thinker forums. And Abby helps and allows myself and to a certain degree Professor Tom Calma, AO, to ensure that we are on track too, and that our presentations and our involvement in these important events run smoothly, timely and informative. And I think that without people like Abby... Sorry?
Sorry, the viewers are just having a bit of trouble seeing you.
Oh, sorry.
That's okay.
Can they hear me okay?
We can turn the light on.
Can they hear me okay?
Yeah,
Turn the light on.
can hear you. Did you want to move to this?
No, turn the light on.
Oh, yeah.
Is it there? Or?
Even if you were to switch seats, then he's closer to the camera. Oh.
Must have got a microphone. Yeah. So look, could people hear me okay? Hear me okay? Good. Good. You can put those lights on. I'm sorry that you couldn't see me.
The above lights were on.
Yeah.
Everything else but those ones.
How much more time have we got, Tom?
No, you're right. You're right.
And yeah. So it's you know, and losing Abby at such a very young age, such a very important staff member, not only to the Poche Centre, and all the good work we do, but also this university, and particularly the Aboriginal medical services and the Aboriginal community that we provide services to. She's just been a power of strength, and she's been a true champion for our people. And we're going to miss her for a long, long time. And it's going to be really difficult to find somebody of the calibre to replace Abby, because she was such loved and so well liked and respected in this arena that we work in now. So I just want to let you know that and let everybody know how important this beautiful young woman is to the work that we do at the Poche Centre. So thank you all so much.
Well, thank you, Bo. And I too would like to acknowledge Abby and her hard work and contribution to the Poche Centre. Abby reminds us that we all need to be very vigilant and ever vigilant at looking out for our families, our friends and our work colleagues. COVID-19, from lockdowns, restricted travel and mixed messaging about vaccines, amongst other things, has had a detrimental impact on many across the country. And with the 80% double vaccination rate for the nation, that's going to open up the country for limited or unrestricted travel. And that becomes a real threat to the health of Aboriginal and Torres Strait Islander people living in remote and very remote Australia, where there are, in many cases, low vaccination rates. And we've already seen that emerge in the Northern Territory now, where we have nine people, I believe, reported in Catherine and Robinson River who have got contracted COVID-19. So I'd urge you all to ask your loved ones and your colleagues, are you okay? Bit of a cliche, but a very important one that we celebrate. Are you okay? And to encourage anybody who's not vaccinated to get vaccinated in their interest and the interest of us as Aboriginal and Torres Strait Islander people across the nation. And that's if you can be vaccinated. So go and have your 2 jabs, and that's going to be important for all of us. We don't want to be in a predicament, as we've seen internationally amongst Indigenous peoples, where some of the tribal groups have been decimated of elders because of losses to COVID. And you know, if anybody, we shouldn't feel shy or shame about contacting groups like Beyond Blue or Lifeline to look at support. It's important for all of us throughout our life to recognise that there are support programs out there for our mental health and well-being. My family heritage is Koongarrikan and Iwija, from just outside of Darwin, but I now live on Ngunnawal country in Canberra. I recognise the Gadigal people of the Aurora Nation and also all the other custodians from all the lands and waters and seas where we're coming in from. Not only in Australia, but I believe that we will be having some international participants in this program, or at least viewers, and that's going to be important. I also want to recognise our youth, who are going to be our future leaders, the custodians of our stories, our cultures, our histories, our languages. And it's so important for us to keep that in mind. As a university sector, it's about our youth and about our future. And so it's important that we do remember that. At Poche Sydney, that's one of the mantras that we'll hear about, is that our strong focus on kids and kids' health to take us forward. For any who might have seen in the last couple of days, and today's the last day, we've got Reconciliation Australia's National Convention that's happened. And if you get the opportunity to have a look at the convention online, you'll see 4 young ladies, all about 7 or 8 years old, talk about their views of reconciliation, about country, about the future. And it's so inspiring to hear that young people have got a vision for the future. And that's a vision that we should all, as adults, and be able to share with them and bring them on. As the chair and patron of the Poche Indigenous Health Network and a member of the Poche Sydney, I welcome you all to this 10th annual Poche Centre Aboriginal Health Research Showcase at the University of Sydney. I've hosted up until today the previous 9, and this will be the 10th annual research showcase. And I must say that each year they're getting more and more exciting. We're seeing such a depth and breadth of research that's involved with Aboriginal and Torres Strait Islander health, and it's so important to do that and to be able to share our experiences. And I acknowledge that many of these projects are led by Aboriginal and Torres Strait Islander researchers. Others we're on there as co-researchers or AIs on the project. So it's important for all of our non-Indigenous researchers out there to ensure that every opportunity is provided to be able to bring our Aboriginal and Torres Strait Islander researchers on board and to help us develop and give us the opportunities that you've been able to enjoy in the past in research. For those that are new to this, the Poche Centres are named after Greg and Kay Poche, who were the funders. They provided $10 million each to 5 universities. The University of Sydney was the first of those universities to receive it just over 10 years ago now. And that money is to look at Indigenous health. So across the 5 universities, that's ourselves, Flinders, University of West Australia, University of Melbourne and University of Queensland, we all do work relating to Aboriginal and Torres Strait Islander health. And this is just one of those platforms that we're doing. The idea of the showcase is to give researchers a platform to share their research, to talk about their programs and their meaningful contribution towards Aboriginal and Torres Strait Islander health in bite-sized chunks, I guess, and to provide the opportunity for networking during and after the showcase. So the more that we can learn about what's happening, the more that we can share. And as you'll see through the presentations, there's some commonality and there's already collaborations happening. But this is a great opportunity for those who may have good ideas to bring them forward to share with the researchers. Over the next 2 days, we're going to have about 26 presentations scheduled. Most of those will be live, although we've got a number of them that have been pre-recorded because the panelists may not have been able to be available at this time. But in most cases, the panelists will be able to come on board and respond to questions. We have just over 430 people registered for the showcase over the next couple of days. So that's going to be great.